It's a good question. I think I want it to help people. I think it offers a wide variety of things, simple things like hemorrhoids and all the way complex things all the way to like colon cancer. One of the things I'm most excited about in colorectal surgery is the advent of the robot. Using the robot in surgery is great for patients, great for me, and I think it's just a cool thing to operate in 3D. Faster recovery time, less pain for the patients. They're in the hospital less days or 0 days, depending on what you're having done. And I think it allows you to have a minimally invasive or not the open incision, versus before you'd probably have to have an open incision. Now we have more options with this, so it's great. Hi everyone, welcome to the OR. I think people always think that you're always going to get a big incision, you're going to stay in the hospital a long time, and the recovery is really long. I think that what they don't know is with the advent of the robot and the new techniques we have, sometimes you don't even need surgery. Sometimes it is a surgery, but it's limited and your stay in the hospital is much shorter and the pain is a lot less. And I think there's some different options that are out there now than they were not even 5-10 years ago. It happens every few weeks where I get to tell a cancer patient, hey look, all of your tumor's out, you're really cured, and you're gonna be fine. Or even better, sometimes we thought it was a tumor, but it was benign, and you don't have to worry. Those are the best days where you give the best news and they're obviously ecstatic. The hardest days at work, and that's still true to this day, I think is to tell people bad news. You know, listen, you're gonna need chemotherapy, you're gonna need more surgery or other treatment options, and you know, the cure is not fully complete until you finish these things. And I think that's the toughest thing to do for everybody, because it's very emotional, anxiety-provoking, frustrating, and sometimes, you know, patients are just angry at the diagnosis because, you know, life isn't always fair. You know, I have to say that it's probably to be hopeful and that they should help, and we'll help you do this, of course, but participate in your own healthcare. Make decisions, be the boss, and we're here to help you along all the way. I think it's important to just, you know, do the routine things that you're supposed to do. See your primary care doctor, get your physical exams. You know, you'd be surprised to see that a lot of things are found on just your regular primary care visit, and do your regular screenings. You know, your colonoscopy at 45, your mammograms at 40, and obviously those can change if you have some family history of cancer, but generally follow the guidelines, and I think that's the best way. I think unfortunately we have been finding colorectal cancers in younger people. That is true. I think it's screening, I think it's awareness. I think we have better tests that we had before. You know, we have the kits that you could send to your home. You just kind of like, you know, do the poop smear and you get a DNA test. That'll help as well. And so it is increasing. I think what leads to it these days is more like the processed foods that we have, the things that we eat. I think we have to be very cognizant of what we put in our bodies, and I think that is contributing to us. And also, we live stressful lives. Everyone's busy, they're not sleeping enough, they're not eating well. I think that's part of the problem, and so we have to make a conscious effort to fix those things. Thanks for having us. Appreciate your time, and I say toodles to everyone. Have a good one.